Good morning and welcome to another of our eMHIC webinars. I must say how much I look forward to these opportunities because this is when we really do realise the goal of eMHIC, which is to share on an international, on a global platform, our knowledge, our learnings of all things eMental health, and the opportunities for us to actually be able to take what somebody else has done and adopt it ourselves. Today, we are pausing and paying respect to and offering our sincere congratulations to our colleagues in the Canadian Mental Health Commission. I'm reaching out across the kilometres to you, my colleagues. You have done a wonderful job in bringing into effect the eMental Health App's Accreditation Framework. What a critical piece of work this is. We know that there are a plethora of mental health apps out there in the digital space, in the online space. You've heard us previously speak at eMHIC about the importance of an ecosystem that actually looks at how is it we are doing eMental health, how we are doing it, and ensuring we're doing it safely is as important as the actual resources themselves. This eMental Health App Accreditation Framework really achieves that at a time when we cannot and should not be trying to contain the number of online resources that are being developed. What the accreditation framework enables is it ensures that people with lived experience, consumers, carers, their families, and those who are service providers can have a sense of safety, can have a sense of quality, can have an understanding that what they are using meets a certain standard. And that is absolutely critical because as we look at the potential for digital, and that's incredibly important for us to do, the second arm of the coat hanger, as you've heard me say before, is what is our responsibility. So as we develop the potential and harness the potential of online, how are we ensuring that anything we are offering to people is safe, is of an evidence-based standard, is quality? That is so important. And this eMental Health App Accreditation Framework that's been developed in Canada absolutely does that. And can I tell you that here from Australia, we're looking and we're going to be learning from you because it is so critical we have those. So I acknowledge and pay my respects to, I think it was over 200 stakeholders who participated in this work that the Canadian Mental Health Commission has done to bring this together. It is a world-leading piece of work. Congratulations, and let's all lean in and hear more about it today in this webinar and learn. Thank you.
Well, thank you very much, Christine. And here in New Zealand, we are also very keenly watching what's happening in Canada and all around the world. I would like to turn now to today's moderator. Ed Mantler is the Vice President, Programs and Priorities at the Mental Health Commission of Canada. Ed is dedicated to promoting mental health in Canada, and is really keen to change the attitudes of Canadians towards mental health problems and illnesses. Welcome.
Great. Thank you so much, Tanya, for that great introduction. And thank you to eMHIC for the honor of being able to moderate today. I'm humbled by the level of knowledge and experience of our panelists, and I'm really pleased to be your moderator today. I'm coming to you from Ottawa, Ontario, in Canada, where I live, work, and play in our nation's capital. And Ottawa is a traditional gathering place on the unceded, unsurrendered territory of the Algonquin and Anishinaabe people. So I'd like to start off by acknowledging the traditional custodians of this land, recognizing the strength, resilience, and capacity of Indigenous people across this land, and paying respect to their elders past and present. And I would encourage you to use the chat feature, the chat button at the bottom of your screen, to post an acknowledgement of the land from which you're coming to us today. And while you have that chat open, I'd encourage you to keep that box open because we will use it to gather your questions for the panelists later in the webinar. So without further ado, the COVID-19 pandemic has really fundamentally changed the way that we access and deliver mental health care and services in Alberta. It's shifted the conversation on eMental health from what is possible and potential to what is actual and necessary. And mental health apps can, should, and do play a part in the future of mental health care as they provide options for those living in Canada to access care when they want it, where they want it, and how they choose from coast to coast to coast. But to do so, we need to ensure that those accessing and delivering care can have faith and trust that the mental health apps they're using are high quality, effective, safe, and appropriate. At the Mental Health Commission of Canada, the work that we do is in partnership with those with lived and living experience. It's a crucial part of our work to co-design projects and resources with stakeholders right from the beginning. Some of the tools, resources, and programs that we've developed in eMental Health include an eMental Health Toolkit, which is a set of strategies to plan and implement eMental Health innovation into practice. The Mental Health Technology and You resource includes visual examples for people seeking care on how they can use technology to access services and supports. And of course, our partnership with Step Care Solutions and Dr. Peter Cornish is scaling up the use of Step Care 2.0, a system redesign project based on recovery principles and a blended approach of in-person and eMental health solutions. Our work on app evaluation actually started a few years ago as we were receiving countless and regular requests from developers to endorse their app and provide advice and guidance to consumers and clinicians on where to find the best apps for a variety of mental health conditions. And as a result, the first step that we took was to create an app evaluation framework. We did that work in partnership with the Canadian Institutes of Health Research, or CIHR. The framework sets out guiding principles and assessment criteria to help people make better informed decisions on mental health apps. Whether it's organizations looking for mental health tools, healthcare providers seeking to make good recommendations to their clients, or app developers working to develop or improve their products, the framework has proven useful to many. We believe that this was an important first step, and we know that there are many useful frameworks in Canada and abroad, but we need to take the next step beyond frameworks to developing a system of accreditation and evaluation that's proactive, that stays current in the ever-changing environment of technology. So back in the winter of 2020, we re-engaged and prioritized this area of need by commissioning work to review the current state of assessment and evaluation tools for mental health apps in order to inform future directions for app users to make more informed choices. Since 2020, we've completed an environmental scan, done a literature review of existing mental health app evaluation frameworks and assessment tools, and we've held a national forum that actually took place in the spring of 21. The forum brought together those with lived experience of using the apps, with providers, researchers, developers, and healthcare executives to discuss next steps forward around the standardization work. Then from spring to fall of last year, we engaged about 200 of our stakeholders to determine the key elements or key ingredients of what national standards for mental health apps should look like in Canada. And we conducted a fairly broad public review of the draft standards. So where we are right now is that we have a final set of standards that we're calling it an assessment framework. And this is a huge milestone. And since we've since validated the content of this first draft again with our stakeholders across the country. So moving forward, this is some really exciting and very necessary work. So I'm really pleased to be able to introduce to you our esteemed panel for today, and I'll be able to moderate some discussion with them. We have three panelists today: Fiona Costello, Nicholas Waters, and Shalene Jones. And I'm very pleased to start with Fiona Costello. Fiona is the Vice President of National Accreditation with ORCA, the Organization for the Review and Certification of Health Apps. I believe I got that right, Fiona. She's the Vice President, so working with governments and policymakers to consider their approach to mental health assessment while supporting digital health suppliers to navigate this emerging digital health infrastructure. So I'll give Fiona a few minutes to talk about her work and her organization, then we'll hear from the other panelists and then come to the moderated question and answer period. So please feel free to add your questions to the chat. And over to you, Fiona.
Thank you so much, Ed. I'm going to share some slides to talk a little bit about the work of ORCA. ORCA stands for the Organisation for the Review of Care and Health Apps. We were founded in 2015 by our CEO, Liz Ashell-Payne, who's a speech and language therapist by background. And ORCA was born out of a frustration. It was born out of a frustration that recognised the impact that digital health technologies could have on the very real challenges facing traditional healthcare delivery. When we think about demand management, capacity planning, resource optimization, patients taking greater and greater control, taking greater interest in their own health, looking and identifying different sources of information. And it was thinking, why has that been so slow to be adopted within healthcare? What are the challenges? Why aren't people really embracing digital health? Particularly in a context where we know that 93% of clinicians believe that digital technologies can help. 83% of people who've used an app say it's improved their health and well-being. 52% of over 65s are willing to receive digital healthcare, and 5 million people download a health app every day. The statistic around 52% of over 65s willing to receive digital healthcare is really actually quite an interesting statistic. Chris Wright from Scotland, he introduced some really interesting research that showed the differences between different generations and how they respond to digital health, some preferring much more sort of communication-based app programs, and some responding to very structured interventions that they could work through. And the reason why I flag that is because it's really important that when we think about digital health, much like we think about medication, we don't think one antidepressant for every single patient. We don't think about one treatment for every single patient. So in the same way for digital health, it's about creating a trusted formulary of a range of different apps that are informed by a range of different techniques and strategies to provide the best possible outcome-focused care to patients, recognizing their individual beliefs and understanding of treatment and preferences. And that is why, congratulations, to echo everyone's comments so far, a massive and huge congratulations to the Mental Health Commission of Canada. The work has been truly outstanding, but particularly the focus on involving those with lived and living experience and its focus on equality, diversity and inclusion. It's been our sincere pleasure to work with the Mental Health Commission on their framework. So a little bit about ORCA. We were founded in the UK. We work primarily with the NHS. Our app libraries and formularies currently cover 70% of NHS regions. We have 7,000 plus healthcare professionals accessing our digital platforms, and by that accessing apps that have been through an assessment process and surfaced onto an app library for patients, citizens and healthcare professionals to download and look at their leisure. To date, we've conducted over 20,000 health app assessments on 9,000 plus digital health technologies. Our scope includes apps that you would access on your mobile phone, but it also includes web-based platforms and increasingly wearables where they link to an app to track and include the data. Our assessment components have grown, as you would imagine, as more and more countries have started to look at digital health assessment frameworks, as the energy around this has really grown in terms of recognizing the value, partly because of the pandemic. The assessment components have covered all major standards and regulations, and of course, the emerging standards and regulations that come. So we currently cover 650 plus individual assessment components over a course of different domains. But with this comes challenges. There are 365,000 health and care apps on the market today. So as a healthcare professional, how do you know which ones are safe and effective? As a patient, how do you know? And as a digital health supplier, how do you position your product to demonstrate that it is safe and effective, particularly where there isn't that classic infrastructure that we see in so many other parts of healthcare? So what ORCA has been founded on, and the principle, is really looking at some barriers that exist for digital health and thinking about the solutions that overcome these barriers. So first and foremost, it's about instilling the trust and confidence, and that is via digital health frameworks. So we have used and helped to create digital health quality frameworks across 12 countries today, with an emerging number of countries that want to work with ORCA, building on the experiences both in the UK, Europe, North America and Australasia. It's about awareness. It's about awareness of the processes so that healthcare professionals have trust and confidence in the frameworks. We can assess digital products up to 500 times faster than anyone else, and we have unique insights into 286,000 products. And what's really interesting in terms of the awareness is we can also re-review. So what that means is that when a product goes through an assessment with ORCA, we automatically get notified as to when it's gone through a product update and upgrade, and we can then reassess the product to make sure that it still conforms to standards and guidelines. The pace at which digital health technology evolves and changes new technologies, regulation is one step, but it's about how the regulation and how those more traditional static models can respond to the challenges that are posed by this very dynamic, fast-moving environment of digital health. And for that reason, we have to think about it slightly differently, whilst also reversing back to traditional governance structures that exist within healthcare, but making sure that the technology is there to enable it. We then focus on accessibility, so digital formularies. We can deliver fully formed digital formularies across all health conditions. So whilst our work in New Zealand, in Canada, in the Netherlands has focused primarily on mental health, the principles that guide and underpin this work can then be transposed to different specialties and conditions. And accordingly, we can make different toolkits to curate these technologies, reflecting the various different operational challenges, but also clinical priorities. And finally, governance, so surveillance and monitoring, ensuring safety and compliance. We continually monitor for changes and updates to digital health solutions. We can monitor changes in particular areas, digital therapeutics as a prime example, and we can talk about the changes that have evolved over that marketplace. So in doing that, we have a couple of different strands that I'm going to talk very briefly about today that will set the work that the Commission have done into context. So from the perspective of ORCA Assure, we help healthcare systems to find, assess and keep safe digital health assets. So as I said, we have data on technologies to help shortlist with an in-depth analysis from 20,000 assessments on 9,000 plus technologies. We have an expert assessment and review team that can assess against recognized digital health standards, providing detailed reports. We have chosen to do a very objective analysis, which means that we don't need very expensive healthcare professional resource to assess digital health technologies. We take the guidelines and the standards and we make it very binary to a yes and no. And the reason being is that we want to do that A, for objectivity, and B, for consistency. And in addition to the frameworks that exist, we can also create enhanced assessment criteria or bespoke frameworks to meet specific needs. So increasingly that a key area of focus, for example, would be interoperability. So in the Nordics, for example, we've done a work on creating a cross-border digital health assessment framework that allows products to go through the assessment and specifically focus on interoperability to guide their deployment onto the Nordic data warehouse, which then allows healthcare systems to draw down. And as I said, monitoring and surveillance of technologies for changes and upgrades. Underpinning all of this, we have what we call the ORCA baseline review. The ORCA baseline review has been established as a global foundation level assessment that takes into account common factors that exist across all the different assessment frameworks across the world and deliberately targets where there's consistencies. So that focuses on clinical assurance, usability and accessibility, and data and privacy. The ORCA baseline review is currently informed by the NICE Evidence Standards Framework for Digital Technologies, which allows us to segment different technologies and ensure that we take a proportionate approach to how we risk weight those products in terms of their potential clinical risk, and ensure that we take a kind of a very score-based approach. So for example, if you imagine a spectrum ranging from digitized patient leaflets right through to digital therapeutics, we can adjust the level to which the different domains play into that overall score. And then once a product has been through that ORCA baseline review, they have an overall app score, which then determines whether they are surfaced onto our app library and formulary. So you as a patient, a citizen, a healthcare professional can have confidence that the product you're selecting has been through that process, and you can actually see it in plain English as to how it complies with those different standards. What the ORCA baseline review also does is it provides incremental progress towards national assessment schemes, of which the Canadian Mental Health App Assessment Framework is one. And the differences between the ORCA baseline review and the ORCA enhanced reviews is that it allows countries to really prioritize and hone down and different organizations on their priorities. So in the case of the Commission, it was around lived and living experience, equality, diversity, inclusion, jurisdiction-specific legislation to ensure that whilst you're benefiting from what is a global marketplace, there's no doubt about that, but still retains the confidence of individuals living in specific jurisdictions within their own governance frameworks to retain that autonomy. And then we have OrcaRx to help deliver safe digital health to patients and citizens via healthcare professionals. In addition to the libraries that I've just talked about, we're increasingly focused on making sure that it's not just about having stagnant assessment frameworks or about how we support digital health suppliers navigate their way towards potential reimbursement, but it's also about how do we activate healthcare professionals to really truly yield the benefits of these digital health technologies in what is an increasingly challenging environment. For this reason, we launched earlier this year the Digital Health Academy, which is focused on the workforce development of healthcare professionals, really targeting digital health education, thinking about what is a digital health product, how does medical device regulation apply, what do I need to think about as a healthcare professional when I look to prescribe. And then we have the full risk management process and framework and granular reporting dashboards to track the impact and identify unmet needs. That is a whistle-stop tour of Orca. We, as I said, we're incredibly proud to have worked with the Mental Health Commission, and I'm delighted to be able to pass over the baton back to Ed to introduce the next Nicholas. But just to echo again our sincere congratulations.
Thank you so much, Fiona. What an interesting overview, and I already have a ton of questions, so look forward to being able to get to those. But before we do, very pleased to introduce to you someone that I have the honor of working with on a daily basis, Nicholas Waters, the Director of Access to Quality Mental Health Services with the Mental Health Commission of Canada. So in our organization, Nicholas is responsible for eMental health, structural stigma, and the development of tools and resources for healthcare providers. He's also the chair of eMHIC's Special Interest Group for implementing eMental health in the workplace. And Nicholas is a member of the Digital Health Equity Working Group for Health Canada. Over to you, Nicholas.
Thank you, Ed, and I'm going to share my screen and share some slides. So just bear with me 1 second. And I would like to echo my thoughts that Fiona said around the partnership that we've had with Orca. It's been an absolute pleasure working alongside our colleagues at Orca. And a big thank you to Anil and his team for enabling this webinar today. So we heard a little bit about how the pandemic changed how we think about digital services and how we think about the use of applications. And we heard a number from Fiona around, I believe it was 35,000 for health and care apps in the global marketplace. And then for eMental health or mental health, and specifically, we know the number is about 20,000 mental health applications. But we also know that during early days of the pandemic, the top 20 mental health apps in the marketplace hit 4 million, which was an increase of about 30% in 1 month from March of 2020 to April of 2020. We also have the stat from our colleagues in the UK that the use of apps and prescribing mental health apps has increased by about 6,500%. But with that comes challenges. We heard from Ed talking about the need to ensure that people are receiving safe apps that are quality-based. And unfortunately, in many cases, that's not the case. And we actually know, and here's a question that if you are in the chat, please feel free to enter your thoughts on the question. But there was a study by the Lancet in Psychiatry in 2019 that looked at the top 700 mindfulness apps, and they asked the question of, how many do you think are based on sound evidence? And so you see some options there. Is it 425? Is it 602? Is it 104? 23? It's actually, so the answer is 23, but there's a caveat to that. So 23 of the 700 mindfulness apps actually provided mindfulness training or education, but only one was supported by empirical evidence. So this is unfortunately a common theme for mental health apps. And we've actually heard that there's been suicide prevention apps that actually use the wrong crisis line number within their app. And so huge challenges that can have some dire consequences. So hence the need for validated apps across the continuum. We heard from Ed about the assessment process to develop our assessment framework. And so as Ed mentioned, it did start with an environmental scan and literature review. And that really helped us get a better understanding of the global marketplace and understand who's been leading in this work, who have maybe tried and encountered some barriers. And so that helped us kind of understand the types of questions that we needed to ask during the National App Forum in 2021. So what should this look like? Should it be integrated into our national mental health strategy? Should it be a standalone? You know, what's the relationship between those two documents? But also learning from those other jurisdictions. And so we always ensure that we have the right voices in the room, including lived and living experience. We had researchers, app developers, health executives, and really anyone who plays a role with either prescribing apps, using apps, or developing apps. And then we went from that meeting to some very in-depth conversations over the summer. So it started pretty much actually in the springtime and into the fall, where we broke each kind of thought area where we thought we might want to develop a standard and had some very detailed discussions with our experts. We then built the first draft of the framework and revalidated that with the 200 or so stakeholders that have been part of this process, either in the working groups or at the initial meeting. We then incorporated that feedback and developed the kind of second draft, which we went out to a public review. So we went to the public review in June of this year, and it was open for about 6 weeks. And so that gave the opportunity for anyone working in the field, anyone who utilizes apps, to really provide us with their thoughts and feedback on this draft. And we heard very positive feedback overall, with really just some minor tweaks to the framework. So we adjusted those, and now we are at a state where we have our final version of the assessment framework. So you'll see that on this slide. This is a bit more about the structure. So of course we started with a glossary of terms, because the standard lexicon and some of the information can be a bit confusing. So some people are new to this area. So we wanted to make sure that that everyone understood when we were defining a term what it meant, so there wasn't any confusion up front. And then we wanted to start with the app review. So this is criteria really to understand the app's core purpose and functionality. So these include things like our target audience for the app, the type of data the app collects, what are the primary features and functions. But these criteria do not have a scoring implication. It really helps understand and set the scene to what type of standards need to be applied to this specific app. So is this an app that provides just wellness information, or does this provide actual services through the app? And so you'll see that the assessment framework currently has 6 different areas of focus, which we are calling standards. And then within each of those standards, there's criteria that apps need to meet. And so right now in current form, there's 421 different criteria within those 6 standards that each app needs to be assessed upon. And we're actually in the process of integrating a seventh standard, which is called the Enhanced Data Sovereignty Standard. And this is domain of an assessment framework that's built from and adopts the Canadian Institute for Health Information's Pan-Canadian minimum standard for collecting race-based and Indigenous data in healthcare. And we want to ensure that we identify and address inequities in digital mental health care, and by prioritizing the safe and appropriate collection and use of this data will be very essential moving forward. And as Fiona mentioned, the criteria that we built this assessment framework off of was the ORCA baseline review, but then it was supplemented with the Canadian content and modified for the Canadian reality. And going back to the working groups, so when we met with each of those working groups, they took a deep dive into all 6, originally all 5 of the areas. And we only added the cultural safety, social responsibility, and equity after hearing from all of those working groups, because that was a thread that really went throughout all of the first 5. And so we decided to add the topic of cultural safety, social responsibility, and equity as a standalone pillar. And I'll speak to a little bit about that on the next few slides. So we wanted to give examples of what the cultural and safety and social responsibility framework or standard looks like. So it includes lived and living experience involvement. So was there any evidence of lived experience involvement in the testing? Is there evidence of continuing work with or to include people with lived and living experience? And usability, is the text or the app readable at a grade 5 level or below? Is the audio supported with the use of captions? For gender, is the language gender neutral? No use of he or she? Is there a representation from LGBTQ2 plus S communities to inform or examples of? Are there visual examples that are inclusive? And then we have a section on Indigenous people's rights. And so this section, this is just an example of some of the types of questions that are asked in terms of the criteria. So has the process been designed and put into a place that allows Indigenous users to easily access and understand and exercise their own data protection? Does the policy specify how the developer will use personal data collection, and so on? And so there's multiple questions within this domain that really speaks to the issue of the use of data and protection of rights. So some of the lessons we've learned is that is really to be inclusive in this process. And so we've always put to the forefront the voices of lived and expertise, of lived and living experience, but also bringing in the researchers, the app developers, policy and research specialists. And so it's ensuring that we have a conversation, but that all voices in that conversation are weighed equally. Not one voice overshadows another, but really creating a safe space to be able to have some difficult conversations at time, but that will really benefit the overall product. The other lesson was really ensuring that we had multiple opportunities for feedback. And so we didn't want to just take the initial feedback that we heard in the March of 2021 and develop a framework just out of that. We wanted to ensure that we had those detailed conversations and then checked back against the information that we were receiving, ensuring that it updated the framework on a few different times going into that public review. So some of the next steps is one thing that Fiona spoke to is the scoring of the standards and the criteria. So not all standards are created equal and not all criteria are created equal. So there may be specific examples where it's a pass fail, maybe to do with privacy, but others there is going to be a weighting system within the framework. So what we haven't done is figured out the exact threshold that an app needs to meet to be able to be certified through the framework. We need to do a translation design. So we will have this framework in both official languages in Canada, so French and English. We'll continue to do some knowledge mobilization by doing events like today. Looking at developing partnerships to ensure that we can promote this work, but also further it. And then most importantly, we don't want this just to be a static document. We want to ensure that we have an online digital formulary where anyone living in Canada can go and access quality mental health apps across the continuum. So it could be for child and youth, it could be for seniors, maybe diagnostic specific for anxiety or depression, but somewhere where Canadians can go to where they can get trusted information. And we'd also like to have a version of the portal for practitioners so they can feel safe prescribing mental health and wellness apps. Then finally, I'd be remiss if I didn't thank the wonderful people involved in this experience. And so you see the core development team names of the Mental Health Commission and ORCA. So now I will turn it back over to Ed.
Great, thank you, Nicholas. Wonderful overview, and what an incredible amount of progress you've made in a relatively short time on a pretty important project. I'm pleased next to introduce Shailene Jones. Shailene has been an advocate, an organizer, an educator, and all-round rabble-rouser in the field of eating disorders for over 20 years. She's held a number of leadership positions with community-based organizations, such as the BC Eating Disorders Association, Langhouse, Peer Support Canada, the National Canadian Mental Health Association, and others, currently the Executive Director of the Eating Disorders Nova Scotia. Over to you, Shailene.
Great. Thanks so much, Ed. And then thank you all for joining us today in this conversation. It was my pleasure to support the work around the standardization of mental health apps that the Mental Health Commission of Canada has carried out. And a joy to be joining you all today virtually from Halifax, Nova Scotia. I'm going to tell you a little bit about my organization, Eating Disorders Nova Scotia. We're a community-based organization working to ensure that everyone has access to the supports they need for recovery. And we believe that no one should have to face an eating disorder alone. We offer a suite of supports that include a virtual text-based chat program, educational workshops, a variety of peer support groups, one-on-one mentoring, a family peer support program, and access to a dietitian, a therapist, and a rec therapist for folks who are impacted by eating disorders, and so much more. And all of our programs are available without a referral or a diagnosis, and our peer support programs and workshops are available across all of Canada. We know that recovering from an eating disorder, like any mental illness, is really hard, and we believe that accessing supports shouldn't be. And so we work hard to identify and address barriers for folks who are trying to access the supports they need. A couple of years back, we saw a surge in requests for support, and that wave has not subsided. Among some groups, eating disorders have doubled, and human healthcare resources and existing programs have not been able to keep pace. The demand has been really high, as increasing number of folks are impacted by eating disorders here in Canada and across the world. And so our challenge was this: how do we, a smallish size community-based group, how do we deliver supports to folks across our province and across Canada without a significant increase in resources? And so back in 2020, we turned to the digital space. And this was an area that we had been starting to work in the last couple of years with our virtual chat and workshops. And so we kind of redirected all available resources to those virtual supports back in March of 2020. And with that decision, we were able to support 4 times the number of people we had planned to. We now serve well over 1,200 people, have a staff of 14, and all of our services are available virtually through a digital platform. So as we've pivoted to this digital space, the work that was done and is being done by the Mental Health Commission of Canada around these standards has really helped guide the way. And so we've been able to use this work as it unfolds to help inform the work that we do. Kind of using as a bit of a checklist and a North Star as we create supports and services and structures that meet the emerging areas that the framework has defined. So things like, obviously for us, those who use our services are involved in the design of all of our programs. We take a co-design approach. So that is true for the digital platform as well, really engaging folks who have access to our supports to help them map out the design and functionalities, users being able to control their data and who they share it with, and for folks to be able to see what supports are available and choose what works for them. So really having them be in the driver's seat when it comes to choosing what programs or supports they might find helpful. We've found that the community that we serve is really well served by virtual platforms. Program participants tell us that being able to access support virtually, digitally, when it's just this part of us being seen, it helps them because they feel less judged because of how they look or how they perceive their bodies look, and being able to access support without having to leave home, of course, has been helpful. For folks who are experiencing disordered eating or an eating disorder and are feeling intense, overwhelming shame around their body, that's really something. We know that it can be challenging at times to access care through the formal healthcare system, and of course, not everyone needs intensive treatment. Making services and supports available through digital platforms enables folks to take those steps to access care immediately, maintaining that momentum. Often we get ready to make some changes and we take the first step, and then we may be on a wait list for months and months and months and months. So being able to provide meaningful supports right away through a digital platform helps people maintain that momentum, and we believe helps them move forward in their recovery in a meaningful way. So as we've all heard just recently, there's a massive increase in apps, good and not so good. And many are targeting depression and anxiety. what we find is missing are apps for coping with eating disorders. And of course, eating disorders are an illness that impacts 1 in 12 people. So they're really quite prevalent and have the highest death rate of any mental illness. So they're common and they're serious and they're deadly, but often are overlooked. There, of course, are, I think at last count, 1 billion apps for weight loss, but not much exists to help folks who are looking to address eating disorders, thoughts, and behaviors. Shame and stigma really drive these illnesses. So it's critical that seeking support for an eating disorder is normalized and resources like apps and digital platforms exist. And of course, it's more than just existing. We need access to high quality, safe, and effective digital platforms. So I'm so pleased to support the work the Mental Health Commission has done around the creation of the standards and really believe it's so essential to move forward in this space. I want to speak briefly about peer support. Here in Canada, this term has become increasingly popular, but it isn't always used to mean the same thing. So sometimes the term peer support is used to refer to like informal support between two people, which it kind of sounds a lot like friendship and is great. But it's different than when the relationship is with someone who has been trained and supported, works from a clear scope of practice, has supervision. We call that intentional peer support, and that differs from peer-to-peer support. So often we see in apps, they'll say peer support, and what they really mean is you can connect with someone else who shares the same life experience, which is a great and powerful thing, but is different from peer support when you have someone who's been trained and is supervised and supported. So having some clarity around things, I think really will help folks make good decisions about what kind of supports and online platforms and apps are right for them. You know, clarity around who is providing support, I think is an important distinction that isn't often clear when folks are choosing an app or platform. As we've spoken about earlier, we really do live in an increasingly digital environment, and too many folks here in Canada and across the world have unmet mental health care needs and are turning to the digital space. And there's a proliferation of commercial products, which may or may not be helpful and may or may not be driven by creating great, easy to access supports for folks, may be driven by more commercial needs. And we really find that standardization helps people make informed decisions about what to use, where to spend their money, and really what to think about when choosing a digital app or platform. So from the field, you know, speaking on behalf of a community organization that works a lot in the digital space, we're so pleased that the Commission has driven down this road around standardization. And we believe that when folks have access to the supports they need for recovery, we really all benefit. So thank you so much for having me today. And I'll turn it back over to Ed.
Great. Thank you so much, Shailene. Some really interesting stuff, and I've already got questions, but we'll be bringing the other participants, the other panelists back into the room for some facilitated discussion, some facilitated questions and answers. And I, again, encourage anyone in our audience to please feel free to use the chat feature to express any questions or comments you might have for all of our panelists, or to be directed specifically towards one panelist if you prefer, and I'll monitor that as we go. You said something, Shailene, that really caught my attention, and that is in relation to the surge in the number of requests that organizations like yours are facing, and the fact that you know, eating disorders for some groups have doubled, and yet the resources that you have to work with have certainly not grown at that pace. There may be some out there, clinicians perhaps, who are skeptics and saying, oh, look, they're just trying to replace me with a machine. Or there might be those you know, system administrators saying, we can do this so much more cheaply electronically. The biggest question for you and for your clients is, will this provide the same quality and level of service, or even higher quality of service? So I hope you can comment a bit on how you see the apps evaluation framework and standards, supporting the assurance that your clients are getting the best possible services that they can?
And I love this question. I am a huge fan of measurement, and by asking the question, like, so what? We delivered an intervention. Did it have the desired outcome? And what was the impact participating in this intervention had on folks? And I love the idea of being able to, obviously really track and measure. And the beauty, I think, of online platforms is that there's easier ways to do that evaluation and to assess, did this support the person in meeting their goals? Were they able to see gains made in their recovery? And being able to offer programs through a digital platform gives us really great insights into what the user experience was as they access various supports and services, what their recovery journey was like, and where they were seeing gains made in terms of their own recovery, where they were seeing improvements in their quality of life. So I love digital apps for that reason. It makes it easier to do data collection. And I think that's what we're all trying to do, is make sure that folks have access to the best quality care that results in long-term improvements for their quality of life and healthcare.
Very good. Thank you for that, Shailene. Fiona, there's a point of clarification that an audience member has put in the chat, and just wondering about the assessment frameworks and their applicability, or the scope of their applicability. Apps, in addition, are you including like online services, websites, online resources and tools?
Yeah, I mean, I think it's important to understand that, there is a big difference between sort of web-based portals and information resources that are made accessible over the web. So by that, I mean essentially digitized information. But we at Orca certainly are able to assess apps that you access on your mobile phone, web-based platforms over the internet, and also apps that are associated with wearables and technologies. So in broad terms, yes, but generally, if people are interested, I'd encourage them to have a conversation so we can dive a little bit deeper into those specific needs and requirements.
Very good, thank you. You used an interesting turn of phrase at the opening of your comments, Fiona, which was that Orca was born out of frustration. And I can relate to that. And I know I've seen myself frustration from developers, from clinicians, from clients. What's the response been from app developers or designers to app assessment frameworks in the jurisdictions that Orca is already working?
I have to say, overwhelmingly positive. I think we need to when we think about technology and we think about health apps, the vast majority of digital health suppliers that embark on this journey, which is by no means easy, are genuinely interested in independent assessment. They're interested in that stock take. Most are actually developed by people that have worked in healthcare settings or care settings who want to improve care, make it more accessible, more easy to digest, and cater to an individual's needs. And therefore they are well used to governance structures. Those who don't, you can draw your own conclusions. But in my experience, and I do a lot of work with the digital health suppliers at Orca, people respond to them extremely well. They really welcome that stock take. And increasingly what we're finding is that where the digital health suppliers are embarking on investment rounds, or they're looking to sort of build out their idea, they're more and more interested in how do they future-proof, how do they develop their solution so that from the beginning it begins to comply with these standards and these assessment frameworks. And as I said, generally speaking, the feedback is overwhelmingly positive across all the jurisdictions, and particularly where it supports them on their journey towards national reimbursement. Most app developers are inspired and motivated by being used, and to be used, they need to be the best that they possibly can be.
That's great, thank you. And Nicholas, you and your team did some pretty massive stakeholder consultations. You did about 200 consultations and then a public review of the actual framework criteria themselves. So, speaking with a wide range of people, including those with lived and living experience, as well as providers and administrators and developers. Are you hearing a similar kind of feedback through those processes as what Fiona's hearing? Like what did you learn through those consultations about the appetite for apps accreditation and what people are looking for?
That's a great question, Ed. And I think maybe not surprisingly, since the app kind of world is deemed the Wild West because there hasn't been regulation, there hasn't been standards. That app developers, as you had mentioned in your preliminary remarks, are actually coming to the commission on a daily basis and saying, we have the latest, greatest app. Can you validate that app? Can you promote our app? And then we have people with lived and living experience asking us for direction and where to access these apps. And so maybe not surprisingly, the developers and those creating apps are really embracing this framework. And so we've actually already, just from doing the public review and the consultation with 200 stakeholders, we have a growing list of app developers that have come to us and said, can you please review our app? Because they're looking also for an opportunity to kind of enhance their standing within the atmosphere, the ecosphere of apps. And so they want to show that they can be validated. They want to show that they're providing safe, quality, and effective care. And so unlike the thought that some had at the beginning of this journey that maybe, people would be a little bit, hesitant to have their apps assessed, it's quite the opposite, because I think they want to be able to showcase the work that they've done, and they want to also know where maybe the development of the app falls short. And so having that ability to receive the evaluation back and then have the opportunity to re-review, as Fiona mentioned, and close some of those gap areas. So it's been extremely positive, and we look forward to working with developers and designers in the future.
That's great. Thanks, Nicholas. And what about what you heard from clinicians and community organizations, for instance? Like, how do you believe that the app assessment framework can benefit community organizations?
I think, Shalene spoke so eloquently about it, but I think one of the opportunities, specifically working with physicians, is to actually have a portal that is within the larger digital formulary that I had mentioned, where a practitioner could go log in and see validated apps across the continuum, and then be able to, with confidence, prescribe those apps to their patients. And part of that process, though, of course, is training. And so we would think that there would be some substantial training with practitioners, because it is a bit of a different way of delivering care. It's not dissimilar to some of the work that we do with our Step Care 2.0 colleagues, where we do have the ability to utilize mental health apps across a step care continuum, but a lot of that is the training. And in terms of community organizations, again, I think often community organizations have developed their own technology or partnered with an app developer to develop apps, and they're also looking for guidance to be able to ensure that they're providing the safest and quality and most effective care possible.
Very good, thank you. And that resonates, I think, with what you were saying earlier, Shalene, as well. I wonder if there are other, maybe more non-traditional partners that you see it would be important to collaborate with on this kind of work.
Sorry, I wasn't sure if you were referring to me or to Nicholas.
Yes, I was, sorry.
Yeah, so just kind of clarification, non-traditional partners. So for us, we always think of like engaging our users, right? Engaging folks who have used the program, and engaging the folks who deliver the program. So we draw upon peer mentors and peer supporters. So we always work with these groups. But I think, what someone mentioned earlier about nonprofit groups partnering with, researchers or commercial platform developers, kind of like bring in expertise from different areas, but really driven by the identified needs of the constituents and the folks that we serve. So really looking at kind of almost like a population health approach to program delivery and trying to get a sense of what are the needs of the population that are not currently being met. And then how do we tap into other partners, corporate and clinical and from the research community, to create a space or a product or service that meets their needs.
Very good, thank you. We have a question that's come in from the audience, and they're kind of, and I'll just give it some context. They're honing in a bit, I think, on comments that you had initiated, Nicholas, around inclusivity and cultural diversity in Canada, of course. being a very, very diverse community, and that being addressed, that attention to diversity being addressed through the standards. Can you speak a bit more? And I think this is a question that all of you may want to weigh in on. Can you speak a bit more about how an assessment framework like this can assess cultural appropriateness for a diverse community, but also specifically for Indigenous populations? Maybe I'll ask all of you to weigh in, but Nicholas, I'll start with you.
Thanks, Ed. And it's a great question. And it goes back to my comments around two pieces of the assessment framework. The first being the new domain around cultural safety, social responsibility, and equity standards. So that's the domain number 6. And going back to the previous comment, maybe not surprisingly that when we started this process, we had the 5 domains, but the conversation around cultural appropriateness, effectiveness, safety within specific communities and Indigenous populations came up in every single conversation. So one is having the right people at the table to ensure that you're actually getting those voices within those conversations. So building the framework with the communities that are going to be using it. But then when you actually look at the number of criteria within the assessment standard 6, there's over 50 or so criteria that actually assess that, and I gave a few examples, but it goes into deep dives into were the community that the app was developed for actually involved? Was it tokenistic? Was it just here's an app? Were they involved in the whole process? Were they involved in the evaluation? Were they involved in the promotion of the app? So it really is the full spectrum of involvement. And also that's why we decided to utilize or I guess include another dimension in the app framework that spoke to the Canadian Institute for Health Information's Pan-Canadian Minimal Standard for collecting race-based and Indigenous identity data in healthcare as that framework, which will be turned into criteria, really it helps address some inequities in digital mental health care by prioritizing the safe and appropriate collection of data. And it's so essential not only just to know how your data is being used, but also how it's being stored, how it's being shared, is it being shared, all of those continuums. So when you look at that assessment 6, standard 6, and then the new assessment, I think, again, there's many criteria that will have to be met to ensure that it's safe for communities. But it goes really back to having the right people at the table.
Very good, thank you. Shailene, Fiona, would you care to weigh in on that cultural diversity and inclusivity theme?
I think Shailene and I are being too polite. We're waiting for each other to go. To echo Nicholas's comments, and I think actually that's what really stands the work, makes the work of the Commission in Canada, but also the work in New Zealand. It really makes it stand out in terms of that focus. And I can't say any better than what Nicholas has said, both in terms of getting the right people around the table, inviting them to comment, but also about data, about not having, unconscious bias in data collection and making assumptions that what works for one population group works for another. And I think, in that sense, it really is world leading in terms of being able to not only recognize that, but also make meaningful steps to really put together an assessment framework that really holds developers to account when they make statements around how they include service users in the development of their product, but actually ask them to evidence it as well. I think it's really, really exciting.
That's great, Shailene.
Oh gosh, how can I cop that? No, you guys said it really well, and that co-design principle is so essential. So nailed it.
All right, and you had mentioned, Fiona, and I may not have I may not be quoting your statistic exactly correctly, but you had referred to the use of apps across the lifespan, and that approximately half of older adults have expressed a comfort or preference with using online tools and apps for their mental health services or for their health services. And I'm just wondering about that. Is there a cultural difference across age groups in terms of some apps may be assessed as being more appropriate for older adults as opposed to middle-aged or younger adults? Is that level of granularity part of the assessment process?
Not today. I think globally it's something that we're definitely working on in terms of understanding how people engage with apps and what factors are most likely to lead to their ongoing use of apps, and how that then is reflected across different demographic groups. I share it. I do think it's really interesting that that there is a difference in terms of the style and the way in which apps are developed and what that means to different age groups, and then how they respond. And like sort of not trying to get into sort of age-based stereotypes, but younger people being much more communication-based, the likes of TikTok and so on, versus very structured information that people can dive into and so on. I think is really interesting, and I think it's something that we'll definitely be looking to pick up in a more kind of a sentient analysis that really does a deeper dive into that demographic analysis. But I also think it's about, again, involving people and not making decisions about them without them. It's about sort of, inviting them to comment on what is it that they feel will motivate them to pick up to an app. What is the difference between this app and that app, and what motivates you to stick with the app? What motivates you to choose that app in the first place?
Very good. Thank you.
I think it's kind of the Facebook Instagram divide when it comes to generations, and thinking about who is the user for this app, and has that particular target group been involved in the co-design? Because you're right, Fiona, what's going to appeal to someone who's 19 is radically different than someone old like me, right?
And me.
I'm not even going to comment on that. So you've got quite a bit of experience now. A huge amount of progress in a short period of time here in Canada, but ORCA active in many jurisdictions. I'll throw this question out for all the panelists to respond. What do you expect or believe that the impact of an app assessment framework is going to have in Canada? Who'd like to jump in first?
I can start. Great question. I think one of the pieces around eMental health or the use of apps that may not be talked about enough is how it can really help reduce stigma. And so we still know that walking through traditional doors, there can be stigma associated with that. Particulars with certain populations and groups. And so we hear often that that eMental health or the use of apps, within their house, or where they're comfortable, or in their car, or walking, can be a real benefit as well. And so I think in terms of how this can benefit the system, I think it benefits the system well if it's integrated, and the system isn't two systems, and we have an integrated approach between physical health, mental health, both online and in person. And I think it's based, if we can base this type of framework within that recovery principle of around choice. And so everyone should have the choice to whatever works best for them. Sometimes that may be in person, sometimes that may be online, and sometimes that may only be online, or sometimes that may only be in person. But by having a validated framework, if we can learn to integrate it and and ensure that there's interoperability between all of the components of the system, then I think it will make some fundamental changes, and it can really help take the burden off of things like traditionally long wait times of 18 plus months and even more for youth mental health.
Great. You're nodding enthusiastically, Shailene.
I know, I'm no good at playing poker, huh? I'm no poker face. Yeah, Nick, everything you said, like that integration, interoperability, creating a recovery path for folks that includes digital health platforms, interactive apps, clinical programs, and really being able to support people whatever need they have, really working from a step care model. So I think it's good for us to imagine what the future could be like, and I think it's very hopeful right now, looking at how we can build these things together, and like you said, the right care at the right place by the right provider. I believe you coined that term, if my memory is correct, and I think the standardization gives credibility to the work that's happening in the digital space, and encourages us to really think about how do we integrate this tool that we have to improve people's lives, because this is what we're all here for, is to improve people's outcomes and help people feel better for longer, right?
Wonderful. Well, Fiona, what impact do you believe that the app assessment framework can have here in Canada, and that your belief is perhaps informed by what you've witnessed in other jurisdictions already?
Yeah, I think that it's I think it's about the confidence, instilling the trust and confidence of healthcare professionals, patients, and citizens to use these technologies and overcome some of those traditional sort of those barriers in the context of traditional service delivery. I think certainly from my experiences of working for a digital mental health product, that it's about the versatility of these products as well. It's about recognizing that it's about creating a menu for an individual to pick and choose what's right for them at different times. So whether that's using a digital health product while they wait to get face-to-face care, whether it's to use a digital health product in support of their face-to-face treatments, but that ongoing journey so that no one feels alone, so that they constantly feel like there's access to support, advice, and guidance as and when they need it, and that they have the right mechanisms for escalation that's controlled, that, like, as I said, that instills the trust and confidence. I also think that what we'll see through assessment frameworks, the improvement and the quality of digital health products overall. We might see a reduction in the number of products available, but those that are available will be really high quality with a significant evidence base, with significant benefits in terms of the usability and accessibility, and crucially outcomes.
Very good. So in order to achieve that vision, that potential for the future, there are some important next steps. Clearly in moving from where we are today, the incredible progress that has been made, into a fully functional ecosystem where developers, clinicians, clients, and all have access to these high quality apps in a kind of a catalog that's easy to use and maneuver. What do you think some of the critical factors or critical next steps in implementation will be to lead us to success? And again, open to all participants, all panelists, please. Nicholas, some next steps, some critical factors to success in the future?
Yeah, it's a great question. I think, just because you build it doesn't mean they will come, of course. And so part of it is really ensuring that people are aware of the framework. So socializing it, ensuring that there's, strong communications and knowledge mobilization. So doing, conversations like today, presenting, of course, validating that through both gray and academic literature is important as well. But besides just the knowing that it exists, I think that we also have to, ensure that we get some additional funding to be able to build out those digital formularies that I referred to. So both for the general public and the practitioners. But it's also, I think, looking at, and you had asked the question, I think, earlier of Shalene around, what type of partners are you looking for in this work? And for us in Canada, of course, healthcare is delivered by the provinces and territories, except a few different examples where it's delivered federally. But there's a public system, there's a private system, there's insurance companies, telecommunication companies. Everyone's getting into the healthcare delivery, and so I think thinking about how we build partnerships with insurance companies, how we build partnerships with telecommunications companies, how we build partnerships with the national provider organization. So I really do think that, like everything we do at the Mental Health Commission of Canada, we don't do it alone. So we need to ensure that we build these strong foundational partnerships to be able to both, get it off the ground, but also then maintain that. And then part of that, next step, of course, is as we build for a digital formulary or platform, is there's a lot of user testing and there's a lot of focus groups that will need to be done, because just because you have a great website as well, you could do all the work on the assessment framework, but if the usability is not very good, then they're going to go once and then they're not going to use it again. So we do have to spend some significant time on that part as well.
Thanks, Nicholas. Shailene? No? Fiona, critical success factors?
I think that I think that whenever we sort of talk about digital assessment frameworks, that it's just as crucial to think about kind of the activation amongst healthcare professionals, patients and citizens. So it's really important that we continue to iterate the assessment framework so that it reflects those needs. I think that, you know, what I think in terms of success factors is trying and testing it, continuing to get feedback from the app developers, continuing to engage with stakeholders to understand if it's continuing to serve their needs. It's interesting because what we see in the UK and some of the other jurisdictions that we work in is that actually this is really the beginning of the journey. What we find is that as all different organizations engage with the assessment frameworks and start to align it to their own priorities as an organization, they really begin to kind of really define what they want from these digital health products and then how that informs their enhanced assessment. And, you know, that's what makes it meaningful for them, and that's what drives activation. And again, I keep saying this, but instilling trust and confidence and that sense of ownership.
Very good, thank you. We're very near to the end of our time, and before we get into closing, Fiona in particular, we may have some participants who are from jurisdictions who have not yet started this journey. For those who may be interested in looking at how to get started, what might some of those first steps be that a jurisdiction would start to take in order to activate a process like this?
I mean, I think what we would say at Orca is there's no point jumping to sort of to create a digital health assessment if you don't have a digital health strategy. So I think the first steps are really thinking about what it is that you want from digital health. What is it that you're looking to the market to achieve? How do you think it will benefit your population? And then how digital can support that to then inform what you're asking of the digital health supplier community and what you're wanting to provide. I think it's really important to understand what digital health products are being used by your population. I do think that, you know, in a world of kind of Google and Amazon, we're kind of seeing an increasing consumerization of healthcare and a sort of an instantaneous sort of instant gratification. I think it's really important that as healthcare systems, we recognize that and we try and get on top of that by being dynamic and responsive to this change, because whether we can have this conversation, but I guarantee that the vast majority of people are using an app on their phone every day, and it's going to happen. So it's really about trying to understand how they're using it to then guide future deployment. And from there, you can begin to think about how you manifest that into a framework.
Thank you for that great advice, and thank you all for sharing your wisdom and knowledge and experience about this incredibly important, incredibly impactful journey. I think it's a really important one. I'm going to give Shailene the last word before Tanya comes in and starts to shut us down, which I know she'll do in just a second. But Shailene, jump ahead in your time machine to September 27th, 2027. What do you see in terms of apps accreditation, standardization, and the delivery of services to your clients in that regard?
Oh, wow. What a question, Ed. I love that phrase, the safe and brave space, and creating that safe and brave space for everyone to have access to the supports they need to improve and maintain their own mental health. So my hope for the future is that we're able to take advantage of the digital space we're moving into and create brave and safe spaces for everyone.
That's an awesome inspiration for us to end on. Thank you, Shailene. And thank you all. I've learned a lot, and I think our participants probably have as well. So really appreciate your time and energy in doing this for us today.
Oh, thank you, everyone. Thank you, Ed, Nicholas, Shailene, and Fiona. Without further ado, I'd like to hand over to Anil Taplial, eMHIC's Executive Director, for his closing remarks.
Thank you. What an amazing webinar. And when I think about eMHIC as an organization, we are about inspiring, sharing knowledge, collaborating, and making the difference. And this is precisely what today's webinar, in my view, has achieved. So much has been covered. And when I look at all these conversations around technology, digital, and mental health, but I want to bring it back to very simple aspects of what does it mean for the end user. So when one of the presentations, Sandy Little from Northwest Territories was doing a presentation on eMental health, and she put it very eloquently. She is one of the program managers at in the Department of Health and Community Services at Northwest Territories province in Canada. The geographical landmass is 1.3 million square kilometers, only 44,000 residents. She said technology, eMental health, digital mental health solutions are not a luxury. They are not an innovation. They are just the absolute necessity. Without that, they cannot even provide the most basic of the basic mental health services and addiction treatment services. So to me, it is about, in some jurisdictions, the bigger cities, we may think about it very differently, but it's also about looking at what time the people are accessing these services. So when I'm looking at the worldwide data from a variety of countries, from Sweden to UK, to US, to Canada, to Australia, to New Zealand, and many other countries, a majority of those access points, one of the programs in Canada alone is Strongest Families, which is from Nova Scotia, grew out of there, is looking at when people are accessing those services is not between 9 a.m. till 5 p.m. on between Monday to Friday. So when people want to access those services, what are those services? What are those options there? And what do they look like? So for us, it's about speaking the consumer's language. While we think we have come a long way, I think Ed's last comment and Charlene's some of the comments around 2027 were just so apt. We've literally just begun the journey, and I think a lot of that will be expanded more into ecosystem conversation at this year's eMHIC Congress, which is on in Auckland, New Zealand in person. And for those who can't travel to New Zealand, they can join virtually on 10th and 11th of November this year. So come and join the conversation and look at the whole ecosystem conversation around it. Today we have covered one aspect of it. I also wish to take this opportunity to congratulate Canada. What a phenomenal work you have done. You are leading, and rest of the world is looking at you, what they can learn from you. So thank you so much, Canada.